Hello everyone, in this video we are going to talk about tibial nerve. So guys, if you not subscribe my channel yet, so please subscribe my channel and also press the bell icon. So guys, let's start our video. So firstly we talk about tibial nerve introduction. So the root value of the tibial nerve is formed by the ventral rami of the L4, L5, S1, S2 and S3. And next, the origin of the tibial nerve. The larger of the two terminal branches of the sciatic nerve at the upper angle of the popliteal fossa. So at the upper angle of the popliteal fossa, sciatic nerve divided into the two nerve, tibial nerve and the common peroneal nerve. Next, we discuss course of the tibial nerve. So it is the largest terminal branch of the sciatic nerve that crosses the popliteal fossa, passes deep to the soleus muscles. As you can see on the diagram, it goes deep to the soleus muscle and in posterior compartment between the flexor digitorum longus and the flexor hallucis longus, and then it passes deep to the flexor retinaculum and give off medial calcaneal nerve which pursues the retinaculum, and then it divide into the medial and the lateral plantar nerve. So firstly sciatic nerve terminate into the tibial nerve and the common peroneal nerve, and then the tibial nerve divide into the medial and the lateral plantar nerve. Next, we discuss the motor function of the tibial nerve. So the tibial nerve innervate all the muscles in the posterior compartment of the leg. They are divided into the deep and the superficial compartment. So in the deep compartment, it gives to the popliteus muscle, flexus hallucis longus, flexor digitorum longus, and the tibialis posterior muscle. So the popliteus muscle that laterally rotate the femur on the tibia to unlock the knee, and the flexor hallucis longus that flex the big toe and plantar flex the ankle, and the flexor digitorum longus that flex the other digit and plantar flex the ankle. Flexor hallucis longus that flex the big toe, but flexor digitorum longus that flex the other digit. Next, the tibialis posterior that invert the foot and the plantar flex the ankle. So these are the motor function of the deep muscles of the posterior compartment of the leg. Next, we discuss the superficial muscles of the posterior compartment of the leg. So in this there is a gastrocnemius, soleus, plantaris muscle. So the plantaris muscle that plantar flex the ankle, and the soleus muscle that also plantar flex the ankle, and the gastrocnemius muscle, this is a chief muscle of the plantar flexion of the ankle, and it also flex the knee. So these are the motor function of the tibial nerve. Next, we discuss sensory function of the tibial nerve. In the popliteal fossa, the tibial nerve give off cutaneous branches. These combine with branches from the common fibular nerve to form the sural nerve. This sensory nerve innervate the skin of the posterolateral side of the leg. So it supply the posterolateral side of the leg and the lateral side of the foot. So the tibial nerve also supply all sole of the foot via the three branches. So these are medial calcaneal, medial plantar and the lateral plantar nerve. As you can see on the diagram, all the nerves mentioned in this. So first one is medial calcaneal branches. So these arises within the tarsal tunnel and innervate the skin over the heel. As you can see on the diagram, this is the medial calcaneal branch. That's root value is S1, S2 is supply the heel. Now the second one is medial plantar nerve. So it innervate the plantar surface of the medial 3.5 digit and associated sole area. So this is the second. So it supply the medial plantar nerve sole area, and the root value is L4 and the L5. Now the next one is lateral plantar nerve. So it innervate the plantar surface of the lateral one and a half digit and the associated sole area. So medial plantar nerve that supply to the medial area, and the lateral plantar nerve supply the lateral area, as you can see on the diagram. Next, we discuss innervation of the tibial nerve. So the motor it for the adductor magnus, biceps femoris, flexor digitorum longus, flexor hallucis longus, gastrocnemius, soleus, plantaris, popliteus and tibialis posterior. And in the sensory, it innervate the posterolateral lower leg and the lateral foot via the sural nerve and the foot sole, as we discussed previous. So this is the motor and the sensory function of the tibial nerve. Next, we discuss the clinical anatomy of the tibial nerve. So first we discuss injury of the tibial nerve. So the causes of it: fracture of the upper end of the tibia or the penetrating wound. That's why it leads to the injury of the tibial nerve. and the muscle paralyzed. So all the muscle of the back of the leg and the sole, because it supplies the posterolateral compartment of the leg and the sole, so all the muscle are affected in this region, and the deformity occur in this calcanevalgus. So in this there is a dorsiflexion and eversion of the foot occur, as you can see on the diagram. So this is a calcanevalgus deformity, and the sensory loss occur over the sole of the foot. So this is the injury of the tibial nerve. Now the second we discuss the tarsal tunnel syndrome. So the tarsal tunnel syndrome is the most important, that is generally asked in examination. So in this there is a tibial nerve may be compressed in the proximal portion of the tunnel before it divide. Most distally either the medial or lateral plantar nerve may be involved. In cases there is the two branches of the tibial nerve may be involved. Hyperdorsiflexion, external rotation and eversion can produce symptom of the tarsal tunnel syndrome. So in this there is a symptoms are hyperdorsiflexion, external rotation and the eversion. So this is the tarsal tunnel syndrome. In this there is a pain worse if the foot is pronated, and tender over flexor retinaculum. So tenderness occur over the flexor retinaculum. Pain in the heel if the medial calcaneum is involved. Pain in the sole of the foot if the plantar nerve are involved. So this is the tarsal tunnel syndrome. In this there is a compression of the tibial nerve occur in the proximal portion of the tunnel. So guys, in this video we discuss about tibial nerve, that is a most important topic generally asked in examination. Hope you like this video. So please like, share, subscribe my channel. Thank you.